Kids often complain of tummy pain, and they can often at times also have worms. Now, oftentimes it happens, the kid is coming and telling you that I'm having tummy pain. It comes and goes, keeps happening. And sometime at the back of your mind, you may be thinking, what is happening? Why this is happening so many times? Is there something serious brewing there? Do I have to see a doctor? Is it something serious? You may have that nagging thought. Let's see what can we tease out. Hi, this is Dr. Agnisekhar Saha. I am a consultant pediatrician and a pediatric intensivist. Now, in adults, we have a very common symptom, headache. Okay. And headache in adults is something that for a big chunk of people having headaches, even if you investigate them thoroughly, you will not find anything wrong with them. But they are still having the headache. And we call these symptoms psychosomatic symptoms, right? So that means even if you investigate extensively, you won't find anything wrong, but the symptom is real. I'm not saying that they are faking the symptom is there. Now, abdominal pain in kids is equivalent to headache in adults. So, a lot of time, a kid may have abdominal pain, recurrent abdominal pain, but if you test extensively, you will not find anything wrong with them. But that does not mean that all abdominal pains in kids are innocent. Okay? Of course, some quite serious diseases can also present with abdominal pain. So how do we know what sort of pain my kid is having? Let's first talk about red flags. That means if the kid is having this sort of abdominal pain, then you should not neglect them. Okay, what are they? One, if the pain wakes the child from sleep, okay, that is something you have to take seriously. Number two, if it is just not pain, but it is associated with some other symptom, any other symptom, maybe vomiting, maybe diarrhea, maybe weight loss, maybe fever, maybe some rash. So if the pain is associated with some other symptom, that is also quite alarming. Then also you need to see somebody. Okay, and then if it is associated with gradual weight loss or some swelling somewhere, that is also an alarming sign. If that happens, then you should take it seriously. And now let us talk about some features of the tummy pain that are innocent. Okay, how those pains are? Number one, they are usually brief. Okay, they will not last more than say 10-15 minutes. Number two, they will not stop doing things. Even though they are saying that I'm having pain, but they will continue to do whatever they are doing. Number three, they usually does not happen when they are doing something interesting that they love to do. They don't stop. It usually does not happen in those times. And then certain clues like, if it is happening only in school and if it is happening only during studying. I mean, this is common sense. Then you can make out that, one important thing to understand is, do not think that he's faking it. I think that's the wrong way to look at it. They are possibly having the symptom, but it does not have any pathology in it. And how to deal with it? Number one, if you are not sure, maybe it is worthwhile to see your doctor at least once to make sure that this is innocent pain. And once you know it is so, then what you need to do is acknowledge the pain. That is important. I am not saying you to neglect the pain. So it happens, you tell me, I know you are having this pain, but at the same time, you remain firm and reassure the kid. So tell him, I know you are having this pain, but don't worry, dear, it will go away. And if you have to give some medicine, you can try something very simple like Calpol, some paracetamol, or sometime maybe some tummy pain syrup. But what is important is remain reassured and also look at the other aspects of the kid's life. Is there any stressor there? Is there something which is causing anxiety in this kid? Is he seeking attention? If he is seeking attention, why he is seeking attention? Do you need to give him more time? So just look into those things, and once you sort those things, it should go away. And we'll also briefly talk about worms. Worms are very common in our country, but they're rarely serious unless it is a hookworm, which can cause anemia. And besides the hookworm, we mostly have two types of worms. One is called pinworms, very small one, and the other is ascaris, big ones. And for that we have very simple treatment, something called albendazole. You need to take it one dose and then repeat it after 2 weeks, and it should take care of it. And worms are not serious. In our country, some people recommend that you should repeat it every 6 months because it is so common. So don't worry too much about worms, they are fine. Thank you.